India is breaking the record for daily COVID deaths. In April 2021, it became the world's new COVID epicenter. And the state of Maharashtra, home to Mumbai, was the worst hit region. And India's lower castes are bearing the brunt of the country's COVID crisis. Working in crematoriums and sanitation facilities, they are some of the most at risk. They're the ones disposing of the dead and risk getting exposed when dealing with COVID victims and their family members. Many of them don't have much protection besides their cloth masks. Even before COVID, the Dalit community was one of the most at risk in India, but their plight usually went unheard.
जब रोजगार नहीं है, जब तक लॉकडाउन है, हर महीना लोगों को राशन तो देना ही है, नहीं तो लोग कोविड से मरने के बाद भूखमरी से भी मरना चालू हो जाएंगे.
In COVID, that distinction has become even worse.
कहाँ जाएंगे, नहीं कुछ करेंगे तो अपना रोजी रोटी कहाँ से मिलेगा बच्चे लोग को खाने के लिए, पेट भरने के लिए कुछ तो सहारा मांगता है. अपना जब पढ़ा लिखा नहीं होगा राह मजदूरी करना ही पड़ेगा.
The state of Maharashtra has the highest number of cases in India by a large margin. In the city of Badlapur, on the outskirts of Mumbai, Deepak Chauhan does the difficult work of cremating COVID bodies.
लेकिन हम लोग अपनी जान पर खेल रहे हैं जो भी है, लेकिन सरकार ने हमारे को कुछ ऐसा कुछ नहीं दिया कि बाबा हमारी फैमिली को अगर हमको कुछ होता है तो हमारी फैमिली को कुछ है क्या नहीं है.
Deepak is part of the Dalit community that accounts for about 20% of India's population. Dalits occupy the lowest rank in India's caste system, which is why many of them work in crematoriums and in sanitation services. In the peak of the second wave, this crematorium was burning about 24 bodies every day.
रात दिन 24 घंटा हम लोगों ने एक हफ्ता हम सोए नहीं, उसमें भी एक हफ्ता हमको नींद नहीं मिली क्योंकि बॉडी के चक्कर में.
Not only were workers not able to rest, they weren't able to use adequate protection.
There is around 100-degree temperature. So when we wear a PPE kit, we will also feel the heat, no? So it is impossible to work wearing a PPE kit.
Crematorium workers who are from other marginalized communities say the risk of COVID was always present.
It was constant. In 20 to 25 dead bodies, there were around 17 to 20 COVID-19 patients.
Deepak says he's been working at this crematorium for 27 years, and he's asking the government to do more. Even though they work on the front lines, Deepak and his co-workers are unlikely to get a vaccine anytime soon, partly because the national government doesn't actually consider them to be frontline workers.
किसी ने नहीं पूछा हमको, ना इंश्योरेंस के बारे में ना कुछ ऑक्सीजन के बारे में कि आप लोग जाके वहाँ इंजेक्शन लो कि क्या लो, पर हमको किसी ने अभी तक पूछा नहीं.
The lack of government support has forced Dalit organizers to fill the gaps. Ramatai Ahire works for the National Dalit Movement for Justice and is a social worker in Mumbai's Chembur neighborhood. Her main work is to interact with her community and advocate for their needs. But today, she's working as a grief counselor.
मोठं काम केलंय त्यांनी. खूप दुःख तर होतंयच आहे ना, पण आपण दुःखावर मात करायला शिकलो. थांबा आता रडू नका. आम्ही आहोत तुमच्या सोबत पहिले पण आणि आता पण तुमच्या सोबत आहोत आम्ही.
Shoda Babar lost her husband to COVID, and Ramatai is here to figure out what happened.
किती दिवस टोटल ॲडमिट होते ते? 3 दिवस. आणि मग तरी का बरं?
व्हेंटिलेटर पाहिजे.
त्यांना काही रेमडेसिवीर वगैरे काही सांगितले होते? किती दिले?
1 दिलेलं.
3 members of the Babar home got infected at the same time, and were all taken to different medical facilities.
मतलब ये कोविड आया ना तो उसका सामना करते समय बहुत डिफ़िकल्टी हो रही है, बहुत डिफ़िकल्टी हो रही है. उसका इन्फेक्शन भी बहुत बढ़ता है जल्दी.
Shoda's husband died after being hospitalized for 4 days. Her stepson Praveen was in the hospital for 2 weeks.
खांसी भी इतना हो रहा था कि मैं चल भी नहीं सकता था.
And he remembers how overwhelmed the hospitals were during the peak.
एक वार्ड में 500 के खॉट थे, एक भी खॉट ऐसा खाली नहीं था, सब इमरजेंसी में भरे पड़े थे.
Praveen is home now, but without his father. Ramatai blames the death on government incompetence.
किती आकडेवारी महाराष्ट्राची बघून भारताची आकडेवारी पासून अख्ख्या जगात भारताचं नाव व्हायला लागले. मग ह्या उपाययोजना 2019चा कोविड सुरू झाला त्यावेळेला जर लसीकरण आणि ही पूर्ण तुर्तता की ऑक्सिजन व्हेंटिलेटर याची जर पूर्तता जर सरकारने केली असती, आता लोकांना पूर्ण याच्यामधून लोक इतके हवालदिल झाले की संध्याकाळी खायचं काय, आता ह्या वेळेला मला काय मिळेल.
While COVID has had a big impact, Ramatai says for those who live in India's poor makeshift neighborhoods, things have always been bad.
निमोनिया से भी लोग जाते हैं, एड्स से जाते हैं, सबसे ज़्यादा बीमारी है टीबी, झुग्गी झोपड़ी में, उससे लोग कितने मरते हैं.
But COVID just isn't another disease the Dalit community has to combat. They also have to fight the economic strains the pandemic has caused. More than 140 million jobs have been lost in India due to the pandemic. Most of them are in what Indians call the informal sector, low-paying jobs where Dalit and other marginalized groups work. The economic strain caused by COVID is what Ramatai worries about the most, and getting the government to financially help the Dalit community is her next big task.
तो ये गरीब लोग कहाँ से भरेंगे, गैस कहाँ से खरीदेंगे, लाइट बिल कहाँ से भरेंगे, ये सरकार ने जवाब देना है हमें.
Even though caste discrimination was made illegal in 1955, the reality of caste structure still exists when it comes to education and jobs, and the lingering biases.
So there are still in 2021, yes, there is a discrimination. People who belong to specific caste will go to the doctor of the specific caste.
Rivat Kaninde is a doctor. He's also from the Dalit community, and he says the government's actions have not been equal among India's different communities and castes.
The effects are there according to the caste. The privileged ones are getting good treatment, and those who are underprivileged, those who belong to backward class and caste, they are getting less treatment, we can say.
The divide is even more apparent when it comes to vaccine access. India just announced that all adults over 18 can now get a vaccine, but those with money can purchase slots at private hospitals, making the divide between the haves and have-nots even greater.
So in case of India, no, we are not equally getting vaccinated. No, we are not getting vaccinated according to the social structure.
There are practical differences too. Many from the Dalit community and marginalized castes live in Maharashtra's tenements. These buildings, called chawls, are so close together that social distancing isn't possible. It's another reason why people from India's marginalized groups like Dalits and Muslims are more at risk for COVID. That risk has led to more discrimination.
ये हमारा अपना पूरा दलित बस्ती है, यहाँ पे कुछ डेवलपमेंट नहीं है, कुछ नहीं है, और यहाँ पे कोविड से सबसे बेहाल है.
Sagar Sakhre is a driver and a part-time social worker. He said his boss has told him not to come to work because he lives in a condensed chawl with lots of families.
झोपड़पट्टी में से आता है तो हमारे काम पे मत आती, क्योंकि तेरे वजह से हमारे इधर वायरस फैल जाएगा.
But even outside of the pandemic, Sagar says marginalized groups have always faced difficulty.
इंडिया में तो देखते हैं जो दलित है वो नक्सलवादी है, जो मुस्लिम है आतंकवादी है.
Many Dalits have overcome caste barriers to succeed in their respective fields. Dr. Revat is an example of that. He pointed out that the Indian constitution helps protect those from the Dalit community and other marginalized groups. But he says that Indian society needs to transform its thinking.
Our founders, they took efforts to make India secular, that every single person from India should get equal opportunity. They put everything in the constitution, but sadly our mindset is not changing.